Hi guys, welcome back to my YouTube channel. If you're joining for the first time, this is Part G Empire Chai Sex Selection. So today I'll be giving you a special topic on guess what? Guess what? Okay, today I'll be talking about PCOS, that is Polycystic Ovarian Syndrome. So, Polycystic Ovarian Syndrome is is an hormonal imbalance. It normally occurs in women of reproductive age. So I have few things, not all, because there are several things that you see in pickers, that you see in yourself, and you know you have pickers. But I just have few things to talk about. Like I have few things about the symptoms to talk. I'm gonna be talking about the symptoms, the diagnosis, as in things that your doctor may be doing on you, and you're going through the examinations. And also I'm going to be talking about the complications and also some home remedies that you'll be doing in order to reduce the or reduce it if you have, peradventure if you've been diagnosed of PCOS by your GP or by your doctor. So grab a cup of coffee and stay tuned. So polycystic ovarian syndrome is a hormonal imbalance. Is a hormonal disorder which usually occur among women of reproductive age. Usually come as irregular menstrual period. It can also come as a prolonged menstrual period. Even sometimes women with PCOS may see their periods, but the periods may be prolonged. It may run more than the normal 5 days. It may be more than that, may prolong to 10 days or so. It's as a result of some other problems like high levels of hormones, male hormones, like example androgens. And again, the signs you see and you know you have PCOS. I have mentioned irregular menstrual period. Sometimes when you look at the how many menstruation you've had in a year is not up to, in fact you don't regularly see your menstrual period every month. It may be like 9 times in a year. Yes. And again, there are other signs like facial hairs on the chest, hairs on, and again, acne. Some women experience acne, facial acne. You will know you have PCOS if you see all those kind of signs, all those kind of male signs, those abnormal signs. As a woman, you are not supposed to see those things on yourself. Again, it could be as a result of, I mentioned is hormonal. It has to do with hormones. Okay, normally on examination, when your ovaries are viewed, uh, let's say you went for a pelvic scan and your ovaries are viewed, your ovary you will appear as if there is something, there are eggs inside, but there are no eggs inside the ovary. What is inside the ovary is like fluid, accumulated inside the ovary. So those fluids just accumulate there, but they don't, there is no egg inside. Is normally known as follicles, you understand, but those fluids will accumulate there, making it look like egg, but they are not eggs and they are not released. You understand? So what do I mean by this? It means that women with PCOS does not, most of them do not ovulate, or even if peradventure you ovulate, it won't be regular. You may ovulate this month, the next month there will be no ovulation. So other things that may be as a result of PCOS could be excess insulin in the blood. There are times that maybe when you are sent for a blood test and or it is found out that there are excess glucose, which insulin in your blood, it may, as in, is also a sign of PCOS. And this excess insulin in your blood could make you overweight, thereby leading to diabetes. You understand? So watch yourself. If you're gaining weight unnecessarily, then you need to meet your GP. You need to meet with your doctor to find out if you've had like two of this out of these three signs I mentioned, which are, I mentioned excessive insulin in the blood. I said excessive androgen, like male hormones in the blood. I also mentioned things like, I mentioned irregular periods. Yeah, if your periods are not what it should be, maybe today you have 28 days cycle, the other day you have 25 days, and the other day you have 30 days, it's irregular. So if all these three things I mentioned, and you have like two out of these three things, then you should go for a blood test to find out if you have PCOS. So generally, PCOS, the cause of PCOS is unknown, is idiopathic, but it could be hereditary. If you have someone in your lineage that already had PCOS in the past, you could likely have PCOS. And in fact, hormonal imbalance and all the other things are the cause, are the risk, are the things that you should be looking at for. Like if you go for test and you have excess insulin in your blood, or you have male androgens, that is the male hormone, you have it in your blood, all those hormones that are not, if it is abnormally high, if it is high in your blood, you have it. Is in fact, generally the cause is unknown, but sometimes they said it is genetic. It hasn't been proven, so that is why the cause is unknown. Diagnosis includes physical examination. Your GP will examine you physically to know if your GP sees acne, facial hairs, those normal physical examination. Will also take your GP will also take your history to know if you have irregular menstrual periods, prolonged periods, to also rule out PCOS. Other things to use to diagnose PCOS are blood tests to rule out excess insulin in the blood. Again, blood tests to also rule out those, to also find out if there is excess androgen, that is the male hormone, and then to also, there is another blood test to find out if you have high levels of cholesterol or triglyceride in your blood. So these are the examination. Okay, there's another examination that is done on you, like ultrasound scan. It's a transvaginal scan that is done. Something your GP will insert an instrument into your vagina in order to view the ovary, to view the appearance of the ovary, in order to see if there are those fluids I talked about, the follicles, the fluids that accumulated in your ovary. Those are the things that is under ultrasound scan. These are the things that will present during ultrasound scan. Then so treatment of PCOS includes lifestyle changes like weight reduction. If you have been diagnosed with PCOS, you should be looking at reducing your weight, by eating food low in calorie, and also improve your exercise. Regular exercise will help you to also reduce the effect of PCOS. And also, PCOS can cause infertility. So when you apply these lifestyle measures, which includes reduction of weight by eating foods that are low in calorie, foods low carbohydrates diets, also you will also reduce the chances of it may help you to reduce this levels of hormones that cause PCOS, and also it can help you to balance the hormone. It's as a result of hormonal imbalance. So another way PCOS are treated is through some medications like some birth control pills, pills that contains estrogen and progestin. So sometimes these medications are injected by your GP, and so in order to normalize the level of in order to increase balance the level of estrogen to help in ovulation. So again is that it will also decrease the level of androgen production. The male hormone I told you about. This progestin and estrogen pills will reduce the production of male hormones that we are already in your blood. Also, therapy like progestin therapy is also done on women with irregular periods. It may be done from within 10 to 14 days in order to regulate the periods and also reduce cancers, because women with PCOS have the chances of having endometrial cancer in the future. Okay, again is that your GP may prescribe clomiphene, that is Clomid, in order to stimulate your ovaries, so that your ovaries will be able to develop the egg and release the egg as well. So and this clomiphene is taken on the second day of your menstrual period. Yes, that's when it is taken. So I didn't say you should self-medicate yourself. Before you start taking all these medications, you have to go to the hospital and get yourself checked first and diagnosed of this before, and then get it's your GP that will know the kind of medication that will match you based on their diagnosis or based on their findings. You understand? So do not self-medicate yourself. Letrozole, which is a cancer medication, is also used to also stimulate ovulation. Then glucophage, that is metformin, is also given to people that their own is as a result of overweight. I mean those that has PCOS. If your own PCOS was as a result of overweight, metformin, glucophage, yes, is also, as in, I mean, is prescribed to reduce the sugar level, so as you don't run into diabetes type 2. So if PCOS is not managed or treated, you will be placing yourself in a danger that is very, very life-threatening. Complications like heart conditions, because it could lead to metabolic disorders like high levels of maybe high blood pressure, high cholesterol levels, high blood sugars and all that. All those things, if they are not regulated, it could be life-threatening. It could you could also have heart conditions. PCOS can also lead to premature birth, that is, and or miscarriage. PCOS can also lead to so many things. It could lead to air accumulating in the liver. Those things are life-threatening. It could lead to abnormal bleeding, diabetes type 2, uterine cancers, so many things. Okay, I said accumulation of air in the liver. No, accumulation of fat in the liver. That's what I mean. That is inflammation of the liver. So many complications if your PCOS is not treated. Overall, what to do? I mean, the normal remedies are reduction of weight, regular exercise, your food intake. You have to normalize your food intake, and also reduce the carbohydrates. In fact, eat like, you know how diabetic patients eat. They don't eat, they deal on more of vegetables, green leafy vegetables, and raw veggies like all this cucumber, garden egg and all that. So deal more on raw vegetables, reduce your carbohydrate content, eat more of raw vegetables, proteins like egg, fish, meat and all that. So, and throw away fats and carbohydrate, these two things, and then do more on these other ones. And then also it's not all fruits you take, because some fruits may increase the sugar levels. So because if you have high weight, if your weight is elevated, it means that you could have excess insulin, which is excess sugar in the blood. So there are some fruits you don't have to take. You have to consult your GP. Like I said before, it's not everything I'm gonna mention here, but if you have seen any signs I mentioned earlier in this video, make sure you save your life and your future. Guys, if you enjoyed this video, do give it a thumbs up. I don't know which one it is. Give it a thumbs up, subscribe, click on the notification button so that whenever I upload the next video, you'll be notified. Have a nice day. Bye-bye.